Have you ever sat in a dental chair with excruciating pain and your dentist walks in, look at the x-ray and said, it is impossible that your tooth has pain. And you wonder, why is this pain so bad? It's excruciating, doctor. And he said, it's impossible. You have no nerve inside. All the nerve went out, like this nerve that we have here, that it was affected by a cavity. All the nerve is out. A root canal is done. It's finished perfectly fine, but you still are in excruciating pain. And the dentist said, it's impossible. You cannot have pain. And you get frustrated because they don't understand that your pain is very real. We're going to talk today and just watch. If you wonder why your tooth is in excruciating pain after a root canal, this is the right episode for you. Hello everyone, I'm Dr. Fanny Yacaman, and today we're gonna be talking about this huge medical myth in the dental field, which is after a root canal, why you are in so much pain and why so many of my colleagues will dismiss the fact that your pain is very real, that you really are having excruciating pain, and you're more frustrated because you spend the time, the money, and all the suffering that you had before. And during the treatment, maybe you didn't have the pain, but now you're in excruciating pain, maybe exactly or worse than before. Today, we're going to talk about why you're having this pain and what are you going to do in the frustrating part where your dentist and some of my colleagues, sometimes they said, oh no, it's impossible. You're going to be okay. No, remember this. You need to learn the red flags that I'm going to give you, how to know when you have to rush to the urgent medical hospital and emergency treatment, or if it's not that important and if this is going to be managed with pain medication, or why is this pain? Where is this mystery? Why the dentist is telling you to don't worry about it when your pain is very real? If this belongs to somebody that you know that is being in pain, or you're suffering for this huge amount of pain, after all the work that we did in your nerve and in your tooth, you have to keep watching this episode because it's for you. So the question is, the most obvious question here is, why when the tooth doesn't have a nerve, when they did the root canal, they went through the crown, and after they went through the crown and they took the nerve out, so there's this not an empty space, it is replaced by gutta-percha, which is a very natural material from the rubber tree, and it's extremely compatible with the tissues of the tooth. So why is it hurting? That's what many people ask. And some of us professionals get more interested in the biology of the tooth, some others don't. Our specialty is extremely mechanic, so it's important that as an endodontist we understand that the biological part for healing this whole tooth, this whole entity, it's very important to do it in the correct way, in the best of the abilities of any specialist. However, this is not a floating tooth, this is not a tooth that is floating on the space. This tooth now that has no nerve, it's surrounded by, we talked in a previous episodes about the periodontal compartment, which is, the periodontium is composed by, periodontal ligament. And what is a periodontal ligament? Is this fibers that you see here, if you can reach between the bone and the tooth and the root, and these are ligaments. They're like rubbers that are supporting like a cushion, so when we are chewing, there's not too much impact on the tooth and the root with the bone. These ligaments are fibers that are so small that they're gonna support the tooth and protect it from any shock, like when we're chewing something hard, it doesn't create an impact right away, so it's gonna help. Not only that, that ligament is also attached to the bone. So we have the bone, the ligament, we have the gingival part, and the tooth is inside the whole structure. Now, we took this whole thing out and we continue with the question, why is this tooth giving me trouble when the nerve is out? That is why I'm telling you now, we gotta remember, this is a whole vascular system. There's a vessel, there's an artery, there's a vein, and when we have the nervous system involved here, and it's like a vascular system, all completely connected to the innervation of our trigeminal nerve, which is the fifth cranial nerve of our brain, and then this one has different branches. So this is a whole entity. It's like the whole brain with the head of the tooth, which is the crown, also is surrounded by dentin, and this dentin have dentinal tubules that are 3 microns. Bacteria are 1 micra. That's why bacteria get reproduced every 20 minutes in big families, and they are the ones who are doing all these problems in our teeth. But the nerve is out. Bacteria doesn't have any food. Why is this tooth hurting? Just remember this information. This tooth is on top of this and the periodontal system, and now this system is all inflamed and it's an alert because the body thinks we are being aggressive, that we're being attacking the system. And the reality is going through a process of healing. So we have the defense mechanism and the immune system, and we have what we did on the clinic. So to finish this part of this episode, just remember one thing. The tooth is not hurting anymore because the inside that transferred the information to the brain is not there anymore to tell the brain, I'm having pain, I'm inflamed. Because this doesn't have proprioception. Proprioception is that they tell the brain, this is the tooth. What it has proprioception is the surrounding tissues. So the pain is not from inside the tooth. The pain actually is from outside the roots of the tooth, which is on the periodontal area. And why is this hurting? Let's see the answer right now. Let's say you're not getting to the point of having this type of pain, but the pain is so constant that the patient becomes chronic infection, because then they said, oh, you know what, doctor, I'm taking painkillers. So this comes down to painkillers addiction. Why? Because then the body starts having pain constantly, and the patient tells you the story, oh, I've been taking ibuprofen, I've been taking Tylenol, I've been taking tramadol, some of them vicodin, Percocet, hydromorphine, nothing stopped the pain. You could be on a risk to be having a pharmacodependency, meaning that now the body knows when they have pain, now you need the painkiller. But none of these medications sometimes will stop the pain. You have to seek help immediately, because it's not good to have a chronic infection that it can become acute. And again, any big infection, especially swelling, you can end up with a septic shock. So you have to run and seek a specialized endodontist that can take care of your problem in the tooth.
3.
This brings us now to a very painful reality. Why so many patients feel ignored, or maybe some of us will ignore that type of pain. I'm extremely overprotective with the patients. We are extremely personalized in this office. So for me, listening to the patient is the key, and really understanding that the patient has the pain that is real. He's not making up the pain. So my chairman in Mexico of endodontics, Dr. Silva Herzog, used to say that in endodontics, so many of us, we develop like a tunnel vision, which means we were gonna look at the canal. Like this is the crown, this is the root of the tooth, and when you can see here, this is the nerve. If you look at the nerve, these are the canals inside the nerve. And this patient was having pain in several teeth. And what happened with her, that we have to start with one tooth that was the most obvious because she has a very deep restorations. And how is the pain when it's like this? I am going to show you an example. Like in this situation, this patient finished having a root canal. This is more than 10 years ago. This is 12 years ago. But she really needed, because she wasn't wearing a night guard and she wasn't flossing correctly. However, many times we say, okay, what is the difference? Where the pain comes? Well, when we have a cavity like this that is very small, if that cavity, you can see here, got to this point and is very close to the nerve, sometimes even if the cavity is very tiny, like it's only here or is deeper, the pain in this type of cavities it can be with hot, cold, sweets when you're chewing. And the patient said, well, the pain kind of is there every time I drink anything cold. So that means the pain is stimulated by anything. That can be the chewing, the candies, the sweets, coffee. Anything will bother the patient and is there with this pain. However, pay attention to this detail. This is a very important information. The pain here doesn't linger. That means it doesn't last for a long time. When it gets worse and the pain is in between, right? The patient said, oh, I have pain in this tooth, but the pain when I drink water is here and then goes to the back and goes to the front. Please go to my episode where I talk about refer pain, because the teeth can only refer pain to one another in the lower jaw, but also can refer to the upper. And that is a complete different topic that if you need more information about refer pain, I will let you know. So you have to be very careful so you not ended up having several root canals when you don't need it. In this case, the pain is not localized. The pain is all over. The patient said it's going to my head. And at that point is because the pain haven't yet get to the nerve and kill the nerve. Even if it's in the nerve, the fact that the cavity is in this position only, in this area only, is not localized, because the nerves don't have these nerves around here and the surrounding area, only the root of the teeth, they don't have proprioception. And when you don't have proprioception, what is the meaning of, oh, they don't have proprioception? Meaning you don't know where the pain is localized. So the patient can have pain in this tooth and then can feel the pain on the other tooth, or maybe in all the teeth.